You know, and then blobs, voidals.
And then somehow it's moving on.
Yeah, it's either like long and thin or. And it's simple. I guess you just have to look at like the top and the bottom of it, you know what I mean?
Don't find much certified.
Like the basal and the apex part, if you look at that part, then you can see it. So I guess like. Taller or.
Yeah. So couldn't that would make sense though, cause like, you know, your skin goes to. Yeah. Yeah.
This is just one, so.
Ideally.
Yeah, no. I guess there's like lots of people. I didn't have time to do it, yeah.
Right.
Yeah.
Try to look it out, right?
Talking about like apex. Yeah.
Yeah, I know what's getting
Like,
like,
I
watch it
for
like
like
3 times. I was so.
Yeah.
Oh.
Yeah, the lumen is called, was like what the lumen is called, but like, what does that have to do with anything?
And then it spelled it out, so I was tempted to write again, but I didn't.
Because for some reason I Yes. What up?
What's the lumen have to do with anything?
It really doesn't.
It doesn't have to do with anything, okay, he just decided to teach us.
That. Yeah.
Alright.
You just gotta do that in there.
Alright, cool, awesome. Yeah, trying to mess this up.
Wanted to see if you're paying attention or not.
Yeah, like I'm gonna insert some nonsense. See if you notice.
See if we catch on.
Wait, wasn't it?
I noticed that. I think it's like as soon as you left,
Oh,
it happened.
that's
How's it
a
going?
lot.
Great, thank you.
I really didn't.
Or you can hear him.
A nice little
It's gonna
nap.
happen after class.
A nice nap.
Anything?
Yeah, I got to work, thankfully. Okay. All right. So,
Yeah, I was.
who'd like to share? What'd you come up with? Any creative ideas for remembering these things or thinking of them or reviewing them? What'd you come up with? Go ahead, what's it?
Oh, okay. I made kind of like a flow chart, like I started with the question, do I see an apical or basal surface? And I
Okay,
said yes, and then I said that it will be an epithelia. On to the next questions. Option no, and I can go on to the other types of tissues.
you have a picture of it? Wrote it down? So, There you go, that's better. All right. All right. So, so you did a flow chart essentially, right?
Yeah,
Okay, and the flow chart was what? What did you ask first of all?
do you guys see an apical or basal surface?
The flow chart, and you asked, do I see flow or basal?
Yeah.
Okay, and then when you get a yes or no, right?
Yep.
So if it's yes, then what?
Then it's in.
Okay.
Then I have what shape is it, and then I have
Shapes. So what are the three shapes again, squamous?
cuboidal.
Okay, then cuboidal. Excuse my sloppy writing, but I'm just trying to, columnar. Because you have the two outliers, two, where'd you put those?
Oh, I
You put them
don't
underneath
those
too?
down anywhere.
You didn't put them yet, so then we have to put the transitional. Also the pseudo. Okay, so we got those two. So then what next? So then you're looking
And
at,
then the layers.
so then you look at the number of layers. So forth. So that's a great way to go. And then if it's one, then it's simple, and if it's two, it's cuboidal, that kind of thing. That's a great way to go. So flow chart is a nice way to do it. And actually that flow chart can grow, because if it's no, then you're gonna have to determine what's next, and we're gonna get into that, which is the active or muscular or whatever. Great idea. So flow chart, I like that idea, flow chart. Anybody else come up with anything? Go ahead.
Well, not really, I don't know, I guess just to, differentiate between like long and flat and long and tall. It's important to look at like the apex and the basal part, so that way you know if it's like, if it's long and skinny this way, or if it's long and skinny that way.
Right.
Otherwise you might like identify something as columnar when it's actually squamous.
Right. So making sure you know it's long and flat versus long and thin, or tall, long and tall, I guess you'd say.
Yeah.
Okay. Anything else? Go ahead.
I kind of have the squamous squashed.
Okay, yeah,
So
like a squamous squashed cell.
Yeah, and
That's
it's
a good way to
kind
look
of
at
in
it.
there. And then cuboidal, cube. Column.
Yeah,
Because of its shape.
right. So the squamish is squashed. That's a good way to remember it. Cuboidal is like a cube shape. Yep, and then
And it's all
Columnar.
in the wording.
the word. So it's easy. So I like that. Squamous, squashed. That's a good one. Very nice. Anything else? So these little tips, strategies, tools are going to help you. Okay, so make sure that you're thinking in these terms as we move on. Because now what we're going to do is we're going to introduce a new type of tissue, the second category, which is the connective tissue. And the connective tissue is relatively difficult at first if you're looking at it from the surface, because you're looking at, like I said, you're looking at a bone, and then you're looking at blood, and you're trying to find the commonalities between the two. Well, how the heck is bone and blood similar to each other? And you may have a hard time finding the similarities, but that's what we're gonna discuss as we go on. Before I do go into that, I just wanted to point out to you, I'm not going to spend much time on this because you can all read and you can all figure this out. But there are, whenever we're talking about glands, and you can see here on the screen, there are all different types of. Would help if I everybody in this. All right, so when we look at different types of glands, remember that glands are made up of what type of tissue, for the most part? Cuboidal, right. So whenever you see glands, make sure that you're thinking, oh, your second term, that's it. Might as well grab that. I forgot to put my pen on, that's why I did that. Had it before, then I switched back out. So your second term is gland. So you got 2 terms already for today. Everyone get that? Remember, when it's a gland, cuboidal. Okay? And this is just showing you different types of glands. This is not a significant learning moment here. It's just pointing it out to you, having the book. All right. I'm going to just talk to you about the commonalities amongst all connective tissues, and then we'll take a break, all right? So, when we are looking at connective tissues are common as far as their characteristics. They might look a little bit different, but for the most part, they're going to have the same components. So if you look at this picture, you see 2 main categories here at the top. We have cells, and we have something called the extracellular matrix. All connective tissue cells, make sure you write this down. All connective tissues have both cells and a matrix. All connective tissues have cells and a matrix. All do. Bones do, blood does, and everything in between. Now the cells could be different types of cells, and these are all examples of cells, but there are more beyond this too. So you could have macrophages, you could have fibroblasts, you could have lymphocytes, you could have fat cells, you could have mast cells, you could have neutrophils, you can even have red blood cells. For example, blood. What are the cells that you'll see in blood? Red blood cells, and what's the other type of cell?
White blood cells.
White blood cells. So you're going to see those. Okay? And you're also going to see a matrix. Now, the matrix may vary from tissue to tissue, from connective tissue to connective. What we see are 2 main components of the matrix. Looks like they're naming the same thing, but they're not. Okay, so number 1 is ground substance, and number 2 would be the fibers. Got it? So the matrix is made up of, or can be made up of, ground substance and fibers, or fibers, right? So in blood, for example, the matrix has the ground substance. It also has fibers, but the thing is, the fibers don't show up unless you're clotting your blood. Otherwise, they're dissolved in the liquid. But here's the thing, and I want you to write this down. This is the most important point for connective tissues that you will get here. The characteristics and qualities. Characteristics and qualities of a connective tissue. Characteristics and qualities of a connective tissue are determined by the characteristics and qualities of the matrix. Say that again. The characteristics and qualities of a connective tissue are determined by the characteristics and qualities of the matrix. If you understand that, it makes everything a lot easier. Because we're going to go further and we're going to look at what are the characteristics, or what are the things, the components of the matrix. And once you know what the components of the matrix are made of, then you know what the characteristics and qualities of the matrix are. So, for example, let's keep it simple. If we have a hard matrix, what is that connective tissue going to be? Hard. If we have a liquid matrix, we're going to have a what? Liquid connective tissue, see? If we have a stretchy matrix, we're going to have a what kind of connective tissue? Stretchy. If we have a tough, durable matrix, we have a tough, durable connective tissue. It's really that easy. You get it? Okay, so let's look at the ground substance. Kids like to do this. You take Jell-O, put Jell-O in your mouth, and then swish it around for a while. Till it's all liquidy. That's kind of like what ground substance is. Or if you make gravy, and then you put gravy in the fridge, and then you pull it out after it's been in the fridge for a while, it's kind of gelatinous, kind of liquidy. That's kind of like the consistency of the ground substance. It's kind of like the filling. That is filling the spaces between the cells and the fibers. Okay, so that's kind of what ground substance is. Kind of like gravy or the liquefied Jell-O. And if you picture us in this room as being like the cells and the fibers, and then you poured a bunch of gravy in here to fill in all the spaces, that's kind of like what a connective tissue is. It's kind of like holding it's kind of like filling all the spaces. So you see no air in connective tissue, it's all substance. It's got something, okay? It's ground substance, or it's a cell, or it's a fiber. When it comes to fibers, if there are fibers present, they're going to fall under one of three categories: collagen fibers, elastic fibers, or reticular fibers. So if we look at collagen fibers are really tough and durable and resilient. Tough and durable. Elastic fibers, what do you think they do? Stretchy. Yeah, they're stretchy. And then reticular, I always vow I'm going to bring this up, but you get the visual. You'll get it. This is support. So reticular fibers are kind of like those red mesh orange bags you get. You know that you buy oranges and they're in that red mesh bag. They have these thin little fibers, but it holds a great amount of weight, right? That's kind of like what a reticular fiber is, or reticular fibers are. It's like they're very thin, but they're really tough, and they're really good at supporting and holding things. So if you think of supporting and holding, that's reticular fiber. All right, so if we have a matrix that is loaded with collagen fibers, what's that going to tell you about that tissue? Tough and durable. If I have a tissue that's loaded with elastic fibers, what's it going to tell you about the tissue? Stretchy. And if we have a tissue that's loaded with reticular fibers, what is that tissue going to do? Support. Yeah, you got it. See? So if we know the characteristics and qualities of the matrix, which are determined by primarily the different fiber types, then we can guess with a high level of accuracy what the function and what the characteristics and qualities of that tissue in general is going to be. Does that make sense? So it's not hard to guess at what the tissue does once you know what it's made up of. And so what we're going to do after the break is we're going to come back and we're going to look at the different types of connective tissues, and we'll be able to look at them, number one, differentiate them from epithelial tissues or any other type of tissue, but also determine the characteristics and qualities of that tissue. And you're also going to be able to learn a long list of connective tissues, but very easily because we're going to break them into subcategories. Let me just get out of here. All right, so we're going to go ahead and take a 10-minute break, and then we're going to come back. We're going to come back about 10 after 10, and then we'll jump into looking at these connective tissues and the different characteristics and qualities of them. Okay? So I'll see you in 10. Okay. All right, so as promised, we're going to dive into the connective tissues and we're going to look at those. And what we're going to try to do, along with that flow chart, kind of along that flow chart idea, is we're going to also be pointing out the differentiations between the tissues you're going to see and the epithelial tissues that we looked at. So we're looking at both types of tissues. So let's go ahead and get started with looking at well, let's. Okay, so actually, okay, so we can actually look at this tissue for starters. Let me just go back and make sure we're sharing this. As I start talking about something, I forget to share it. All right, so this is the one. Okay. So the reason why areolar tissue is a great tissue to start with. Hope I don't have to recalibrate this thing. Or it's not going to have me do that before. Okay, no, good. All right. So one of the reasons why the areolar tissue is a great tissue to begin with is because it's kind of what I call areolar tissue is kind of like the jack of all trades. It kind of does a little bit of everything. And you can see that because why? Why would I say it's the jack of all trades, kind of does a little bit of everything? What are you seeing? Got a little bit of everything. Like what? What are the parts of a connective tissue? The two main components. Cells in the matrix. So tell me about the cells. What do you see? Fat cell. What else? One type of cell. You've seen multiple types of cells. Yeah, you're seeing a lot of diversity as far as the cells. So a lot of diversity in the cells. So it does a lot of things. Macrophages, which are part of the body's defense system. Fibroblasts, making the fibers. Lymphocytes, again, part of the body's defense system. Mast cells, same type of thing. Fat cells, so we're seeing a little bit of storage, energy reserve. We see a lot of variety here. What about the matrix? What are we seeing in the matrix? Different types of what in the matrix? Fibers in the matrix, right. So we see a little bit of collagen, a little bit of elastic, a little bit of reticular, so it does everything, right? It's kind of tough and durable, but it's kind of stretchy, but yet it kind of supports things, right? So you can see that areolar tissue is sort of this jack of all trades. So when we're breaking down our connective tissue types, the first subcategory of the connective tissue types are the loose connective tissues. Okay, so we have connective tissue, and then one of the subcategories is going to be loose connective tissues, loose. And there are going to be three types of loose connective tissue. And this is the first one, areolar. Now, the reason why they call this a loose, quote unquote, loose connective tissue is because it's not, the stuff isn't densely packed together. We're going to see what we call dense connective tissues, which is going to be the next category. And the things are crammed more closely together. But here there's a little bit of space. There's a little bit of ground substance between the components. So here is a picture of areolar connective tissue right here. Now you can see the description, function, which is going to wrap and cushion organs. Like I said, it's going to have a lot of different functions because of all the different cells and the different fiber types. And here we can see it. We can see it under the epithelium of the body, mucous membranes around the organs, around capillaries, kind of supporting and cushioning things, but also keeping things in place and having a little bit of give, speaking to the collagen and the elastic and the reticular fibers that we have. So tell me what you see in this picture. What are you seeing? What do you see? Tell me. Nothing. It's a blank square. It's white. Okay, we see lots of fibers going away. We see really thin fibers here. We see some thicker fibers here. Yep. What else do you see? Yeah, you see nuclei here all over. We have the elastic fibers, collagen fibers. Just because of the way they stained this, the reticular fibers aren't really coming through, but they are part of this. Okay. So we already saw epithelial tissue. How does this differ from epithelial tissue? I'm not seeing an apical or basal surface on this picture. That's clue number one. What else are you seeing in here? What are you supposed to see in an epithelial tissue? Yeah, layers of what? Layers of cells. We see cells, but they're certainly not arranged in layers, right? So you can see the difference between this and an epithelial tissue? I hope you can. I mean, this is we don't see, you know, here are the nuclei of the cells, but the cells are not in rows. They're not organized. We don't see apical basal surface. We don't see any of that. Very different. Yes? Cell membrane of these, they're not showing up on the stain. These are all stained. So when you're looking at it under a microscope, it wouldn't show up like anything, but they use certain stains to make certain things show up. What's showing up using the stains that they used, or what's showing up because of the stains they used, are the nuclei of the cells and the fibers. So the answer to your question, which is where are the cell membranes, you're not really seeing them here. Which is another clue, right? Because in the epithelial tissues, you could really see the cell membranes, right? You can see where the cells began and ended. But you can't see that. These are all the clues that you're trying to piece together to, number one, determine what type of tissue it is. So we see cells and we see fibers. This is like flashing lights, explosions, that this is a connective tissue. Okay, so that's areolar. Here's the next type of loose connective tissue, adipose tissue. What do you see on this picture? What does it look like to you? Yes, well, some nuclei, sure. Snowballs. They look like snowballs. They're big, white, circular structures, right? Don't see a lot of fibers. The fibers are in here, but they don't stain very well. But there really aren't a lot of fibers either. What you see here, what you're actually seeing are large droplets of fat, and because there's so much fat in these cells, the nucleus gets pushed to the periphery. Another one. Okay, so the nuclei are getting pushed to the side because these are full of fat. So these are used for cushioning and also for energy reserve. So our two types of loose connective tissue so far start with A. We have areolar and adipose. We have one more type. Reticular. Guess what type of fibers are the predominant type of fiber in this connective tissue? What are the three fiber types? Collagen, elastic, and reticular. Called reticular tissue, so what do you think the most predominant fiber is going to be? Reticular. Yeah, don't make it harder than it is. Reticular fibers. What does this look like to you? Tell me what you see. It's not about what I see, it's about what you see. Yep. Yeah, kind of looks like tree branches. I've heard that before. Yep. Anybody else? Cherry blossom tree. Yep. You got the white blood cells that you see in there. And it doesn't matter if you know what kind of cells they are. But what you're seeing here are these really thick, dark fibers, kind of look like branches of a tree or look like a tree. And you see like the things in the tree, cherry blossoms or whatever you want to call it. So if you see something that looks like this, it might not be this color, because sometimes they stain different colors, but if you see these dark branching type of fibers, it's a big clue that it's a reticular type of tissue. It's a reticular tissue. The big cells, or the big nuclei, I should say, of the cells and the branching branching fibers. Okay, so this is reticular. So what are our three types of loose connective tissue? Areolar, adipose, and reticular. There you go. Boom, 3, done. Then we move to the dense connective tissues. So this is another subcategory. We had loose connective tissues. We had 3. Now we have dense connective tissues. And guess how many there are? 3. Enough, right? So we have loose connective tissue. We have dense connective tissue. And to make it even more complicated, this is called dense regular connective tissue. So even the name has dense in it. So that's even easier, right? So we have dense regular connective tissue. And you can see the main type of fiber in dense regular connective tissue. What type of fiber did I circle? Collagen, which means this tissue is going to be what? Characteristics and quality. What is it going to be? Tough, durable, right. It's going to withstand tension. You're going to find these in tendons, ligaments, and so forth. The reason why they call this a dense tissue, besides the collagen fibers, what else do you see in this picture? A couple nuclei here and there, but boy, this is packed together, right? Not a lot of matrix, right? It's like packed together. So what are you seeing in this picture besides what I already mentioned? What does this look like to you? Looks like what? On the surface, it kind of looks like muscle. We're going to see how this differentiates from muscle. You'll be able to tell the difference, but I can see where you say that. Looks like what we would see as muscle if we were just to look at muscle by itself, right? Not microscopically. Yep, you got it. What else does it look like? Paint strokes on a paintbrush. Kind of going in the same direction, right? What else are you seeing? Yep, like waves in water, kind of going in the same direction. Anybody else? They're all great things, so that's why I want to make sure we capture these. Doesn't matter what it looks like to you, but just so you're capturing what it looks like to you. But dense regular connective tissue is kind of wavy, and all the fibers are oriented in the same direction. That's why they call it dense regular connective tissue, because all the fibers are going in the same orientation, which means it withstands pulling in one direction, as it says here in the function. So if we have a muscle which is pulling on a tendon which is attached to a bone, we're going to be pulling it in one direction. As opposed to this one, which is called dense irregular connective tissue. Again, this is making it easier for us to remember the 3 types of dense connective tissues. We have dense regular, we have dense irregular. What are you seeing here? Marbling.
All over the place, there's
Order? Yeah. Yeah, looks like a marble tile, right? Just, you know, you're cutting through the rock and you're getting all different things. Yeah, it looks a lot like that. Like I said, different pictures might be different colors, but you're seeing randomness, right? Disorder, no organization. Anybody else seeing anything differently, or they want to add to this one? Well, here's the thing. What kind of fibers do we have here? Collagen. So what's the difference? What's the difference between this and the picture we saw before? Yeah. The fibers are not all moving in the same direction. They're arranged randomly. So what would be the advantage of having randomly arranged and randomly oriented collagen fibers? Yeah, they can get stretched no matter which direction. It says right here in the function, withstands tension exerted in many directions, provides structural strength. So this is good for your joint capsules, because your joint capsules move in many different directions. So they have to withstand tension. Dense irregular connective tissue is also found in the valves of the heart. Think about the beating that the valves of your heart take. all that turbulence. So dense irregular tissue is made up of this collagen fiber, really tough, really durable, but it withstands tension in multiple directions. Got it. You also find it in the dermis of the skin, which we'll talk about next week. But again, it's dense. You don't see a lot of matrix in here, right? Everything is just densely packed together. You don't see a lot of spaces in here. You see a couple cells, but really when it comes to the ground substance, I shouldn't say matrix, back up. You don't see, excuse me, a lot of ground substance because there aren't a lot of spaces to fill. All right, so we have dense regular. We have dense irregular. And this is the third type of connective tissue. This is a little bit trickier because it doesn't have a dense in front of the name. It's just elastic. Now this one can be tricky. Tricky. If you look at a magnification like this, because they're pulling the magnification out a little bit. We're only at 250 times, whereas in the one before we were at about twice that, 430, here we're at 430. So we're not quite as zoomed in on this picture as we were in the others. So if we ask that first question, do you see an apical or basal surface? Do you see that here? It looks like it, right? So if we're using our flow chart, we're saying, does it have an apical or basal surface? Kind of looks like it, okay. Now we have to look at what this actually appears to be. Do you see any sort of cellularity here? Do you see any squamous cells or cuboidal cells or columnar cells? Do you see them? Yeah, it doesn't look like it's really anchored. Yeah, you're right. I agree with that. So what we're seeing here are fibers. So like I said, most of the time you'll see it zoomed in enough where you don't see the edges of the tissue, so it's no problem. But I think it's a great lesson here in that even though you might see what appears to be an apical and basal surface, and even if an apical and basal surface appear, you still need to go further and you need to look at the next step, which is what are the cells? Are there cells? Do I see cellularity? Do I see cuboidal or squamous or columnar cells? Do I see them? And I'm not really seeing them here. What I'm seeing are very darkly stained fibers in here, which are actually elastic fibers. So because this is loaded with elastic fibers, what's the function of this tissue? Yeah, it has to be able to stretch. Allows tissue to recoil after stretching. You got it. So you can see large arteries, ligaments, and so forth. Okay, so what are the three types of dense connective tissue? We have dense, regular, dense, irregular, and elastic. So we've got 6 because the loose connective tissues are what? Areolar, adipose, and reticular. And then the 3 dense, regular, dense, irregular, and elastic. Okay, so now the next category, subcategory, is going to be cartilage. And guess how many types of cartilage there are? 3. The last of the 3s, though, which is good news because we're reaching the end. All right, so there are 3 different types of cartilage. And this one is the easiest of the 3 to identify. The other 2 are a little bit more difficult. And so we'll compare them and contrast them. What are you seeing in this picture? What's that? Groups of nuclei. Yep. Little bugs. Okay. What else are you seeing? Right? Like little eyes, maybe. So, I mean, whatever it takes, whatever it looks like to you. Some people see eyes, you know, bugs. What else do you see? Three-eyed? Yeah, three-eyed monster. So really you're seeing this, there's lots of space in between the cells here, right? These are actually chondrocytes. Chondrocytes are cartilage cells. We'll talk about what a lacuna is when we get to Learning Plan 6. Don't concern yourself with that yet. But we're seeing cells that are usually in groups kind of look like eyes or bugs or whatever, but we see them grouped together in clusters inside this matrix. Sometimes this has a bluish color, but sometimes it's like this purplish type of color. This is hyaline cartilage. Hyaline cartilage is very tough, durable, and very smooth. So you're going to find on the ends of bones. So if you eat, let's say you eat chicken. Everyone here sometime in their life eaten chicken, a chicken leg? So if you eat the leg of a chicken, if you get into the meat of the leg on the chicken, sometimes if you clean off the meat on that chicken leg, you get below the meat, and then at the end of the bone, you get to this really hard, shiny chunk of cartilage on there, on the end of the bone. That's hyaline cartilage. You ever chew into that accidentally? No? Well, that's what it is. It's very firm, shiny, smooth kind of cartilage. This is what lines the ends of the bone. What allows for a smooth, gliding surface so that the bone isn't grinding against anything. You're going to find the end of long bones, but you're also going to see it between your sternum and your ribs, osteocartilages. You see it in the nose, you see it in the trachea, the larynx, you see it in multiple places. So the first type of cartilage we have is hyaline cartilage. Then we have elastic cartilage. Guess what kind of fibers are in elastic cartilage? You're going to see that it's going to be like your ear, your external ear. That's elastic cartilage. You can kind of bend and move it around, but it kind of goes back. You know, if you push your ear down, it doesn't stay down, right? It goes back where it was. Okay, so this is elastic cartilage. Again, you can see the chondrocytes, but now you can see those elastic fibers in there, darker, right? These darker staining fibers in here. So that's the second type. So we have hyaline, we have elastic, and then we have the final type of cartilage, fibrocartilage. But again, like I said, kind of hard to see the difference in the fiber types between this and elastic, because you're going to see the only difference is the type of fiber. It's collagen fiber again, but it's more random in its arrangement, and the collagen fibers are more dense than we saw in hyaline cartilage. You still see the chondrocytes. Now we're not zoomed in as far as we were in the other ones. So if you go back to this one, we're at 800 times. Here we're only at 125 times. If we zoom this into 800 times, it would look very similar to this. That's what I would say is, if you're going to go on anything, you could say, well, the chondrocytes are more densely packed here in elastic cartilage than fibrocartilage, but it's tough. So rarely I'm going to ask you to differentiate between the two. Anything that counts big time anyway, like on a test or something like that. I'm not going to ask you to differentiate those. But anyway, this type of tissue is designed to withstand shock. So you find it in the discs between your vertebrae, for example, or in the symphysis between bones. So it's kind of like a cushion. So what are the three types of cartilage? Hyaline, elastic, fibrocartilage. Yep. So we're really, really, really close to the end here. So you've learned 9 different tissue types for connective tissues already, believe it or not. There's 11. So we'll learn the last 2. One is called bone. So the giveaway for bone, what do you see here? What does this look like to you? What's that? Yeah, like when you cut a tree and you see the rings on the tree? Yeah. So if you see like rings of a tree, that's good enough. That'll work, right? Can you see them? So if you see these concentric rings, that's bone. Everything's really densely packed together. We'll talk about what these different parts are, the lacuna and the lamella and the central canal. We'll talk about those learning plans. Not important right now. But if I showed you a picture of this, you pretty much be able to identify these are concentric rings, right? Bone is a pretty distinct. But do you see anything else? a particular type of bone. There's compact bone like this, and then there's also spongy bone. We'll talk about the spongy bone later. Don't worry about it. But if you see this, bone, okay? So we have loose connective tissue, dense connective tissue, cartilage, bone, and then the last one, blood. So the giveaway here, lots of space between the cells, and you have these red blood cells here, some white blood cells. Red, white blood cells kind of randomly and sparsely thrown out there. That give away that it's blood. All right, so let's go through our connective tissue types. So, what's the first subcategory of the connective tissues that we talked about? Let me grab something here. All right. All right, I heard it. So of our connective tissues, first one is, that's not what I wanted. Heck. First one is loose. So what are three types of loose connective tissue? Areolar. What's the next one? Adipose. Next. Articular. Okay, what's the next category? And what are the types? Next. Okay, what else? Okay, what's the next subcategory? Okay, cartilage. What do we have? Hyaline. What's next? And? Cartilage. Okay, then we have other two categories. Bone. And what else? Blood. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 11 different tissue types. Good job. Okay. So what I would like you to do, again, I want you to take some time, grab a partner or two, and I want you to what I want you to do is I want you to discuss with each other, why are connective tissues different from epithelial tissues? How can you tell the difference between the two? And then I also want you to describe how both bone and blood and all the other connective tissues with their diversity can be the same type of tissue. Okay, I want you to describe that and explain that to your partners, all right? Let me again, so I want you to be able to tell me the difference between epithelial and connective tissues, explain that to someone else, and then explain why there's such diversity in connective tissues that you can have a bone or you can have blood that is a connective tissue and all the other tissues in between. Okay, so I'll give you 5 minutes to do that. So at about 1:45, then we'll jump back in and we'll talk about some other tissues. All right? So 5 minutes.
Cells animation.
So it's really tight again.
Yeah, I'm not totally sure what. Like red. I mean, that part looks pretty right. I just said like, I really hate it. I have one.
What are some things you came up with? How'd you describe it to another person? So how do we know the difference between an epithelial and a connective tissue? Go ahead.
The connective tissue.
Cells, but we don't see. Look at it. Look at a connective tissue versus an epithelial. As cells, and the cells are so tightly packed together that there's no space between the cells, right? In connective tissue, we see space between the cells, right? So if you cells and space separating the cells, then you know you're in a connective tissue. Because there's no space between the cells and an epithelium. They're always right next to each other. No space between cells. So that cells that are distant with space connected. You see cells that are right up against each other, cell, 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 then that's an epithelium. Got it? All right. So now we're going to move on to the second last type of, oh, actually you got the second last type of tissue that we're going to talk about. Right, so here is muscular tissue. We have three different types of muscular tissue. The first one is called skeletal muscle. Now, of these tissues, of all the tissues that we're going to talk about, this type is probably the most familiar to all of you before you even came. So, before they come into an anatomy class, because they've learned somewhere along skeletal muscle, smooth muscle. Skeletal muscle is under voluntary control. So when we talk later about the nervous system, we're going to talk about something called the somatic nervous system. And the somatic nervous system is the part of the nervous system which we have conscious control over, conscious awareness. So the somatic nervous system is hooked up to, so to speak, to skeletal muscle. We have voluntary control. We can move the way we want to with skeletal muscle. In the muscles of the body, we're going to learn skeletal muscles. All right? So what are you seeing here on this picture? What does this look like to you? Very organized. Yes, it is. It's very organized, very structured. What else? Worm or a centipede. So you see like different segments, right? Yep. Okay, what else? What's that? Steps? Yep. Okay, you can see steps. What else? Yep, the nuclei are in little strips. Oh, what did I do? Again. Guy along the way. Okay, what else? Some people say that looks kind of like window blinds on its side. But what we're seeing here, you're right on. It's very organized, it's very structured. We see stripes, we see nuclei. So these stripes are called striations. Light, dark, light, dark, light, dark. We're going to talk about those when we get to learning plan 8 and talk about the muscular system. For now, you can see the striations, the stripes, the lines. And you can see perpendicular to the striations, we have the nuclei. We have multiple nuclei here. All right? Great. Very organized and structured. What do you see on this one? How's it differentiate? What do you see that's different? Not as organized. Right, it's more random. What else? Compare and contrast. What things are similar? What things are different? Yep, we still have striations. Under involuntary control, yes. Cardiac muscle. We can't tell that by looking at the picture, but yes, it is. What else? Yeah, the nuclei are more round, and they're definitely not as structured and organized. So we see a lack of structure, lack of organization. And what we're actually seeing here are branched cells. Instead of long cylindrical, we see short branch cells. And where those short branch cells come together, we see these dark lines here, darker lines. These are called intercalated discs. It's where the two cells come together. But it is striated. Is correct what somebody said. It's under involuntary control. So we have involuntarily contracting striated muscle. That's cardiac muscle. This was skeletal muscle. Long, cylindrical, organized, striated. nuclei are all in the same place versus this, which is much more random. More disorganized, branched, short. Okay, then we have this third type, smooth muscle. Now this can be a little bit tricky. This picture is unlike most pictures that you'll see of smooth muscle. I think it's a better picture than you'll see most of the time because it makes it easier for you to differentiate and determine what this is. What are you seeing in this picture? What? Peacock feathers, yeah, because of the color. Yep. It does. It does look a lot like that. What else are you seeing? Ocean floor. Okay. Yep, I can see that. Yeah, it kind of looks like an epithelial tissue, but we're lacking the apical and basal surface. But yeah, I can see that because the cells are very densely packed together. Might be thinking, is this a squamous, stratified squamous epithelial tissue? Thing is, with the stratified squamous epithelial tissue, the nuclei aren't going to be nice and round and puffy like that. They're going to flat, like this. What's that? Yep, dense irregular connective tissue kind of looks like that. What we didn't see with dense irregular connective tissue were this many nuclei. So this one's tough because it looks like some other things. For me, what you're looking for are the nuclei that are packed closely together. There's a lot of nuclei in here, which you're not going to see in the dense connective tissues. You're not going to see that as, let's put it this way. If you're going to see stratified squamous epithelial tissue, the cells will be flatter, the nuclei won't be visible, or they're going to be very flat. So we know that it's probably not that. But the thing that makes this tough is just because it's a very generic looking tissue. It can be kind of a lot of things. The thing that I want you to know is that these are spindle shaped cells that they taper off to a point. So a spindle shaped, a smooth muscle cell kind of looks like this with a nucleus pointed on each end. Kind of see that in this picture. You'll see other pictures that kind of show that as well. Under involuntary control. So this one's a tough one, but it's the third type of muscle tissue. So we have skeletal muscle, we have cardiac muscle, we have smooth muscle. Right? Fair enough? And then the last type of tissue we have is nervous tissue. Nervous tissue is pretty easy because you see these almost triangular or kind of tapered off types of cells with the strings between them. These are the axons. And it stains relatively yellow every time. So if you see like a yellow stained type of tissue, neuron cell bodies, this is nervous tissue has other cells in it too, but we're not going to talk about those necessarily. But it is a tissue because it's not just the neurons, it's actually other cells that are in there as well. A relatively yellowish staining type of tissue with these triangular or pyramidal or kind of these type of cells with all the strings extending from them. That's nervous tissue. Okay, so we know all the tissues of the body now, right? So we have the epithelial tissues. What are different types of epithelial tissue? Simple and stratified what? Squamous, cuboidal, and columnar. We have the two outliers, transitional and pseudostratified. Then we get to the connective tissues. And what's the first subcategory of connective tissues we talked about? Loose connective tissue. So what are the three loose connective tissues? Areolar, adipose, and reticular. Then we have the next subcategory, which is dense. We have dense, regular, dense, irregular, and elastic. Then we have the next category, which is cartilage. Right, cartilage. And we have three types. What's the first type? Hyaline. What's the next one? Elastic. And the third? Fibrocartilage. Then we have the last two connective tissues, which the hard one is bone, not hard like hard to remember, but physically hard. And then we have the liquid blood. Okay, so there, got all the connective tissues. Then we have three types of muscle tissue. What's the first type? Skeletal. What's the second? Cardiac. What's the third? Smooth. And then we have the fourth tissue type, which is nervous. See, you got it. Boom. That wasn't so bad, right? When you categorize things, you put them in their place, it's easier to remember. Think when I told you you'd know them all by the end of today that you really would? Not that bad, right? It's not that bad. A lot of memorization in this class, but you can do it. Same when we get to the bones of the body. It's not so hard to remember them once you put them all in categories. All right, so in your book, you do have, I'm still sharing here. In your book, you have a wonderful table that will take you through the different types of connective tissues, table 4. So again, this is nice and structured for you in case you want to refer to that as far as the subclasses that we had talked about. I call them subcategories, or the cells, matrix, and the features of those. So make sure you look at that. A few more things to finish up on, but I'm going to ask you the question. It's really up to you. You've been sitting for a while, been going through a lot. If you want, we can take a break, a 10-minute break, come back and finish it up. Or we can just finish up the stuff now. I'm going to do some closure, so we're going to be reviewing everything we talked about. So it's up to you. What would you like to do? I would guess we probably have about another half hour left. Do you want to break before we get into that last half hour, or do you just want to go? Who wants to just go and get it done a little bit earlier? Most of you? Okay, we'll do it. We'll go through. All right, we'll power through. No problem. All right, so last week we talked a little bit about serous membranes. Remember that? The balloon, the fist in the balloon, lubrication, reduction of friction. Remember that whole thing? Okay, so we already talked about serous membranes, and you'll see that here on the right-hand side. We talked about that. We don't have to revisit that. We have the visceral and the parietal layer, yada, yada, yada. All right. We have two other types of membranes that we're going to discuss. All the picture I have for it. All right. So let's focus on this one here first, the mucous membranes. The difference between a mucous membrane and a serous membrane is, number one, the serous membrane is not open to the outside environment. It's sealed, it's closed off, it's considered sterile. It's not exposed to the external environment, all right? So serous membrane, not exposed to external environment. Mucous membrane is not sterile. So we have, for example, the nasal cavity, the oral cavity, the esophagus, trachea, the digestive tract, the respiratory tract. So these are all lined with membranes which are called mucous membranes. So they're going to have mucus-producing cells in them too. So because we have exposure to the outside environment, you're going to have a significant portion of the body's immune system embedded within the mucous membranes as well. Because there's food that you're putting into your body that may have pathogens on it. Hiccup? Oh, okay. Okay, just want to make sure it wasn't anything. All right. So we have food that we're putting in that could have potential pathogens. The air that we breathe in could have pathogens within it. So our body has to have some sort of line of defense. So the difference between the mucous and the serous membranes is their exposure, all right? Then finally, we have this last type of membrane, the cutaneous membrane. Another word for the cutaneous membrane is the skin. Covers the body surface, all right? So cutaneous membrane is the same as the skin. We have the serous membranes, we have the mucous membranes, and the cutaneous membranes. Okay, the last thing we're going to talk about today, as far as the new stuff, before we go back and put some closure on and a cap on what we've talked about today, is tissue damage and tissue repair. Now this kind of bleeds over into, no pun intended, bleeds over into Learning Plan 5, because what we're seeing here, after you cover Learning Plan 5, you're going to see we have the 2 layers of the skin. We have the epidermis and the dermis. But what we're going to talk about is how the skin and the tissues repair themselves. And so we have a few steps involved in tissue repair, and you see the 3 main stages here: inflammation, organization, and then regeneration. So let's look at the first step. I don't know if I have them separate. I do. Okay. Your third term is the term repair. Get that taken care of, and then we'll go on to the different. Does everyone have that? Not have it. All right. So first step is inflammation. So let's pretend that something penetrated the skin, damaging the tissues. What are some concerns here about something penetrating the skin and coming into potential contact with the blood supply? What's a potential concern here? Infection, disease, pathogens, right? So our body needs to make sure that we're taking care of that. But we also got another problem, right? There's damage. Okay, so first step is inflammation. And inflammation is kind of doing 2 things at one time. So let's think about picture your residence, wherever it is that you live in an apartment or house, whatever it is. Imagine that a car were to crash through the front wall of your residence. Okay? Car crashes through the wall. Now you've got a big mess. So you got to back out the car. So what are our concerns? What do we have to do? We have to patch up the hole. What else? We have to clean up the mess. Yeah. And what else? Well, we don't have to do that. Yeah, we sue the driver. Yeah. What if it was you that did it? Yourself. What's that? Yeah. What else? Gaping hole. Anybody can just walk in, right? Potentially, right? So you got a couple of things that you're concerned about. That's a couple of things that our skin is going to be concerned, our body's concerned with. Number one, we have to make sure that we don't have any pathogens that are causing an infection locally or systemically. Number two, we've got this big gaping hole now. We have to patch it up and repair it, but we also have to make sure that we kind of temporarily close things off while we're working on it, right? Because you're not going to get a construction crew in that day to clean up and rebuild it in one day, right? So you're going to have to kind of just put up a tarp and kind of a temporary patch until things kind of get underway. So the first step, inflammation, is kind of taking care of all of those things at one time. Number one, the blood vessel is going to bleed, and so we're going to set up a scab formation. That's kind of like your temporary patch to kind of cover things up so that things can't get in anymore, but also allowing things to heal underneath. Blood clot as well is doing that. But now we have inflammatory chemicals that are released. And these inflammatory chemicals are going to cause an increase of blood and fluids in the area. And why would you want more blood and fluids in the area? What's that going to do? What's that? Yeah, it's going to flush out. It's going to flush out the stuff. It's going to help flush out the damage, clean up the damage. It's also going to bring the things that protect you in. So if you picture the cells that make up your blood vessel walls as like my interlaced fingers, if I have something that needs to get through my fingers, it's going to be hard to do, right? But if I can cause inflammation to occur, which means I'm going to bring in more blood and fluids into the area, what's it going to do? It's going to stretch apart my fingers, right? You see how now there I have spaces between my fingers? This allows like your immune cells to get through, squeeze through the cells that make up the wall of the capillary so they can get through and they can start taking care of the infection, neutralizing any bacteria or anything that might be getting into the area. So inflammation is important for a lot of reasons. Number one, it's going to help you bring the immune agents in so that they can start cleaning up and making sure that any potential pathogens are taken care of. And you see that here, that the white blood cells that the oh, come on, back again. Work. White blood cells that are usually stuck here in the capillaries, they can squeeze through, and now they can get over here to start neutralizing any pathogens. And we're also flushing out the area, allowing for us to kind of clear out the area, clean it up. So that's the role of inflammation. The next step is organization. Now we get the construction workers in, and they're going to start repairing the damage. They'll have the macrophages and the white blood cells in here, making sure everything stays clean, but we're going to start to rebuild and repair. So what we see is we have granulation tissue, which is kind of like this, kind of like a tough, rigid, almost like a collagen type of tissue that comes in and starts to patch up the area. You can see that the scab is still there. So below this purple level, the dermis. And so the dermis is made up of dense, irregular connective tissue for the most part. So we're going to repair this with collagen fibers, like the dense, irregular connective tissue. Above the purple line, this is the epidermis. We'll talk about that next week. This is stratified squamous epithelial tissue. It's living tissue. It's cells. So what we see are that the cells just migrate toward each other and then fill in the area. So we're going to start to see filling in here with cells, and we see repairing of the damaged tissue in the dermis. So then finally, the last step, regeneration and fibrosis, gives us our permanent repair. We've regenerated the epidermis, and we've also repaired this area. We restored the blood vessels, and now you can see we leave behind an area of tissue that's a little bit harder. It has a little bit more collagen tissue than the original tissue. So if we have a deep enough penetration of whatever it was that damaged the tissue, we actually see the formation of scar tissue. Now, scar tissue just doesn't appear one day and then it's there and then it's done. Scar tissue can, depending on the nature of the injury and depending on what you do to the area, scar tissue can be remodeling itself for quite some time. So if you have a scar and the scar appears reddish, even if it's months after the damage, if it appears red, it's still an actively repairing scar. It's not until that scar turns completely white or that whitish color that you can consider that it's completely healed and done and moved on. So, so just food for thought. It's not a major point, but trying to tie it into things that maybe you've seen or that you can relate to, that might make it more real life for you. So that's about it. Last year, or it was earlier this year. I shaved my head all the time, and earlier this year I really sliced it. It was bleeding like crazy. What I should have done is, but it was bleeding too much for me to take pictures of it. But I should have taken pictures of it as it was healing, go through the stages of healing. But that. So some of you watched the video that I posted from last spring. You see I had this big bandage on the side of my head because I I had just done it like earlier that week. All right, but I don't see much red here anymore. Maybe you can see it. Maybe someone can see it, but it was right here. Right here. I can't remember what side it was anymore. It was that it healed that much. But anyway, body's amazing. It can repair itself very well. Okay, so let's do some closure. Let's circle on back and go through what we covered before. Okay, so tell me a little bit about epithelial tissues. What do you know about epithelial tissues? Educate me, as if I'm a person who never heard about them before. A basal layer and apex layer, okay? What does that mean? What's that? Okay, so epithelial tissues have a top and bottom layer called an apex and basal aspect. Fair enough? Okay, tell me more. What else do you know about epithelial tissues? They're very compact, which means what? Spaces between them? Okay, fair enough. What else? Go ahead. Okay, they're defined by their layers and what they do, meaning what?
The
If it's one layer, it's simple. It's more than one layer, it's stratified. Repeating because they may not hear the microphone. I'll turn up these a little bit more so that they can maybe hear a little bit better. Anyway, okay, what else?
They're usually anchored to the baseline.
They're anchored to a basement membrane. Yep. What else? Tell me about the shapes.
There's
They do.
squamous, cuboidal, and columnar, which the squamous is kind of squashed, kind of square, and it protects and diffuses and filtrates what's going on.
Okay, so we have squamous, which is a squashed, flat type of cell. Okay, so if you only have one layer, it does what?
It protects and filtrates.
Not protects. If it has one layer, it only does the
Filtration.
filtration and diffusion. Yep.
Yeah.
If you have more than one layer, if it's
stratified.
thank you, stratified. Stratified, then it's where it would be protection. And how does it protect? How does stratified squamous epithelial tissue protect? What does it do?
Sloughs.
Yeah, it sloughs off layers, right? And they're dead. They're dead cells. We'll talk about that next week. Okay. You told me about squamous. What about cuboid?
I already cute.
Cube shaped. Yep.
They secrete.
They secrete. Where are they found?
Glands.
Glands. All right, good. Good. What about the other types? Columnar? What about columnar?
They absorb and secrete a little bit.
They absorb a little bit. They secrete a little bit. What else?
So in the digestive tract.
Mostly in the digestive tract. Yep. Okay. What else? Tell me more about epithelium. Is that it? Just those three types?
There's two outliers,
Two outliers? What are they?
pseudostratified columnar.
Okay, tell me about pseudostratified columnar. Why do you call it pseudostratified columnar?
It's regular shapes rather than the columnar where it's all straight and tall and thin and all the nuclei kind of line up. It's just kind of more scattered.
Okay, so in a simple columnar, it's very organized. You can see the columnar cells. The nuclei are all arranged in a single line. But in the pseudostratified columnar epithelial tissue, what I'm hearing is that they're all connected to the basal layer. So there's one layer, but it looks like multiple layers because the nuclei are all different levels and the cells are all different shapes. What's the function of a pseudostratified columnar epithelial tissue?
Trick you.
What's that? To trick you? That's not the function. It doesn't exist to do that. But what else? It's like a columnar, except it's found in a different area primarily. Found more like in the windpipe and the respiratory tract, mucous membrane. So what does that tell you? What do you think your function of that tissue would be?
Lubricate.
Lubricate through the mucus secreting goblet cells, you got it. What else? Mucus also does something else. Protects, how so?
It like dust or any other particles that get in your airway, it wraps in mucus in the cilia, pull it out.
You got it. So it's ciliate, it has these little hairs. So the pollutants, the air particles get stuck in the mucus and then it uses the cilia to kind of move that stuff back up. So it's like hacking up mucus, you know, when you're sick and your mucus cells go into overdrive and you're coughing up all this brown, disgusting mucus. It's your mucus going overdrive to try to keep that stuff out of your body. Very good. So there were 2 outliers, so what's the other one? Do you have a question before we go on to that one?
Yeah, so columnar also has the cilia, right? So it can like push other things along, like food and such.
Cilia is not used to push things along, it's used primarily to keep things out.
Oh.
So keep things back out. You might be thinking of microvilli.
Okay.
And microvilli are like finger-like absorbing structures that are typically on columnar epithelial tissues. But they're not responsible for movement. They're just responsible for absorbing. So the movement that occurs within your gastrointestinal tract is muscular. It's moving it along through muscular activity.
Okay.
Got it? Okay. What about the other outlier?
Transition.
Transitional. Tell me about transitional.
Function is to stretch, so you.
Functions to stretch, okay.
Primarily in the urinary tract.
Primarily the urinary system, right? So like the bladder, the ureters, so forth. Yep. What is shape, characteristics, qualities? What are you telling me about that?
Somewhere between the squamous and the cuboidal.
Cuboidal, yeah, you got it. So if it's relaxed, it's more cuboidal. If it's stretched, it's more squamous in its appearance. Flattens out, yeah. We good on that? What questions do you have about epithelial tissues? Okay, tell me about connective tissues in general. What do you know about connective tissues? Without going into all the different connective tissue types, which you know pretty well already.
They all have cells and matrix.
They all have cells in a matrix. What's a matrix?
A matrix kind of tells what the function of the connective tissue is.
It tells what the function of the connective tissue is. How so?
The different kind of fibers or the ground substance.
Different types of fibers. Okay, so what are the different types of fibers found in a connective tissue?
Collagen, elastic, and reticular.
Collagen, elastic, and reticular. Okay, so tell me about each of those. Tell me about collagen.
That one is tough and durable.
Tough and durable. Okay, what about elastic? Stretchy. And how about reticular?
Support.
Support, yeah. Okay, so what are you saying? So you're saying that the matrix determines the characteristics and qualities of the connective tissue. So how is that? How does a matrix determine the qualities? Based on its fibers. What kind and how much, right? Got it. You got it. Okay. So what are the different types of subcategories of connective tissues? Loose, dense, cartilage, bone, and blood. Okay. You feel comfortable about those? We talked about them a lot, so I don't think we have to go through that all again. But what I want you to know, what I want you to be able to do is to identify the tissue upon sight. I'll take you through the lab thing before we go. If I begin to forget, remind me. So what the tissue looks like, you have to be able to differentiate it from other types of tissues. I want you to know what its function is, but if you know the composition, that should help you, and then also where it's located. Again, if it's not in your assignments, then you don't have to know for the test. But just so you're aware of that. Let me do that before we get any further, because I want to make sure that I show you the lab assignment so that way you can kind of get a feel for it. All right, so if you are in Blackboard. Where I am is I clicked on your course assignments, learning plans in Blackboard. Clicked on that folder. And then here I am at learning plans 4 and 5. All right, so what you're gonna do is you're gonna access what we call, I don't know why this is switched around. No. Oh, I see what I did. Okay, I got it. Now I get it. All right, so your learning plan 4 lab assignment says your assignment is based off the slide shown in the practice anatomy lab. To access it, click here. It'll take you to this link here, and you just click on Practice Anatomy Lab 2.0. It's going to open up a new window. This is actually pretty cool, interactive here, and you can use it for other things other than what we're going to be working on. But what we're going to do is we're going to come over here to this tab called Histology. You click on that. Look here. Looky. Here are your 4 main tissue types. We also have the tissues according to the different systems. But I'm just going to show you here. So in your assignment, you go to your lab assignment, you click on that. You're clicking in 2 different places. I hope you caught that. So to get into the lab, to look around, you click on this link, but to do the actual assignment, you click here. Got it? So when you click here, it's going to take you to the assignment. Okay? And then you're going to see pictures here. It says identify the epithelium. What do you think this is? Okay, yeah, it's apical basal surface. Looks columnar to me, right? How many layers? Okay, simple columnar, that was hard. All right, you got it. What's this one look like? Very organized. Yep, striations. The nuclei are kind of squished out. Intercalated discs are found in this type of tissue. What do you think?
What?
Intercalated discs.
No.
Where do you see intercalated discs?
In cardiac.
Cardiac. Is this cardiac? Oh, see, there you go. So anyway, here are all the pictures. And then all these pictures come from your practice anatomy lab. So if you are looking at different types of tissues, you can find it here. So this is your practice. If you want to practice looking around or whatever, or if you're having a hard time with it, this is what I recommend you do. This is just like any lab. If I were to have a lab that you all had to come to and say, I want you all to look at these under a microscope and tell me what you see, this is kind of what it is. There are 3 different levels of review. You can do the self-review, which is the easiest, quiz, which is like the middle of the road, the practical, which is the hardest. Okay, but you can do whatever you want. But anyway, if you click self-review, it's the easiest because it'll show you everything. If you click here on show labels, see it shows you that this is skeletal muscle tissue, tells you what these are.
Nuclei.
And if you click on it, you can tell it what it is. Okay, great.
Sarcomere.
All right, so anyway, that's that. That's the self-review. The quiz is a little bit more like the multiple choice questions that you got. What structure is highlighted? I don't know, it looks like a sarcomere to me. Let's try it. Okay, it was wrong. It was fiber. What the hell are you asking me? I don't know. Anyway, it's a way that you can review. The practical is the toughest one because you actually have to type in the thing. So anyway, you can use this for your practice, and you can use it for the assignment if you need to. Okay, so that's the lab assignment. This is what you need to complete, not what I just showed you. This is what you need to complete. Okay, we okay with that? Square on that? All right. So anyway, that's that. Okay, so what are the other different types of? What are the 3 types of muscle tissue? Skeletal, cardiac, smooth. All right, good. And we have nervous tissue. All right, tell me about serous membranes versus mucous membranes. What's the difference?
Serous isn't exposed.
What's that?
The serous isn't exposed
The serous is not exposed to what?
to the outside environment.
To the outside environment, the external environment, correct. Whereas mucus is exposed. Okay, so where do you find a lot of your immune system then? Mucous membranes, you got it. Good. What are the 3 steps of tissue repair? Inflammation is the first one, where you're flushing things out and bringing the immune agents in. Number 2, organization, where you're repairing, right? Reorganizing. And the third one? Regeneration. Good. All right, thank you very much. Make sure that before next week that you submit another assignment, okay? Make sure that you're squared on it. Otherwise, we're good to go. Thank you very much. Take care.